Today's topic is related disorders of Acanthosis nigricans, and in turn we are going to see about the diagnosis of the Acanthosis nigricans. Symptoms of the following disorders may be similar to that of Acanthosis nigricans. Hence it is used for differential diagnosis. First one is Addison's disease. Addison's disease is an endocrine or hormonal disorder that occurs in all age groups and affects men and women equally. The disease is characterized by weight loss, muscle weakness, fatigue, low blood pressure, and sometimes darkening of skin in both exposed and non-exposed parts of the body. Addison's disease occurs when adrenal gland do not produce enough hormone cortisol, as a result of which we get an hypocorticolism. The disease is also caused by the adrenal insufficiency. Cortisol is normally produced by the adrenal gland. This cortisol most important job is to make the body respond to stress. Among its vital tasks, cortisol helps in balance of the effects of insulin in breaking down the sugar to energy. Burkitt's nervous. Burkitt's nervous is a late onset birthmark occurring mostly in males. It is also known as Burkitt's melanosis. It is due to overgrowth of the epidermis, upper layer of skin, pigment cells, melanocytes, and hair follicles. It is developed during childhood or adolescence on the shoulders, upper tongue, occasionally elsewhere. It is thought that is due to a gene defect which has not been identified. A Burkitt's nervous is a large one-sided patch, sometimes observed over half back or chest. After puberty, it becomes darker and quite hairy, and features also called as hypertrichosis. Goigot-Carotid syndrome. Goigot-Carotid syndrome is a known confluent and reticulate papillomatosis. This is a rare skin disorder that primarily affects girls and women. Symptom onset typically begins soon after puberty. Associated findings include development of flat-topped, wart-like, solid-like lesions, papules, throughout a brownish appearance up to 0.5 cm in diameter. Lesions typically initially develop in the midline of back between the breast. They may be gradually extend in all directions, spreading over the breast to the upper middle region of the abdomen and down to the pubic region, as well as up to the down and back. In some instances, sides of neck and shoulders may be eventually affected. As this lesion extend, they typically merge, become confluent, becoming irregular or net-like patterns, reticulated patterns. Following a gradual progression over a few years, the condition tends to stabilize and the lesions remaining unchanged. Although Goigot-Carotid syndrome has sometimes been confused with benign Acanthosis nigricans and pseudoacanthosis nigricans. Expertise indicate it may be different from Acanthosis nigricans upon the characteristic of skin distribution patterns and age symptom onset. In some instances, Goigot-Carotid syndrome appears to be randomly for unknown reasons, sporadically, in absence of the family history. However, there have been few instances in which one family member has been affected, potentially an autosomal dominant trait. In some cases, Goigot-Carotid syndrome has been shown to be associated with infection like yeast fungus known as Tyrosim orbiculare, also called as Mazzelia furfur. They are normally present in skin. Reports suggest that condition may be a beneficial response to treatment with antibiotic medication, monocycline, or therapeutic with retinoid agents. Next is Acanthosis hystrix. Acanthosis hystrix is a rare inherited syndrome. It is characterized by scaly skin lesions called as ichthyosis, mild to severe. A thin, horny skin, keratodermoma, on the palms of the skin and soles of the feet may be with no other symptoms, or whole body surface covered with scales. Psoriasis and plague. Psoriasis and plague is a chronic superficial scaly dermatitis, CSSD, or chronic superficial dermatitis or digrade dermatitis. It's the most uncommon chronic skin condition characterized by round or over red, slightly scaly patches on limbs and tongue. Chronic superficial scaly dermatitis mostly affects adults, especially men. The cause is unknown. Chronic superficial scaly dermatitis begin insidiously with one or more slightly scaly patches. The commonest site is the lower limbs, but the trunk and upper limbs are more often affected. It is a seldom seen on the face, palms, and soles. The patches are generally round and oval, but finger-like process can also common, especially on the abdomen, and accounts for alliterative name digitate or finger dermatosis. The patches are found 2 to 5 cm across the larger areas at home times, especially on lower limbs. The color is pink, brown, and slightly yellow. The individual patches have been oftenly slightly pink. Now we'll go to the diagnosis of the Acanthosis nigricans. Acanthosis nigricans can be diagnosed upon a clinical evaluation, identification of the physical findings, and complete patient history, including a careful medication history. Throughout the family history and various specialized tests. The age and the direction may vary depending upon the Acanthosis nigricans present and other factors. For example, benign Acanthosis nigricans often become evident during childhood or puberty. Less commonly, benign Acanthosis nigricans may be apparent at birth or develop during puberty. Later cases mostly typically involve the association of obesity that's called pseudoacanthosis nigricans. Pseudo means false. In contrast with the onset of malignant Acanthosis nigricans, which in turn occurs above 40 years of age. According to the experts, various factors may suggest for malignant Acanthosis nigricans in association with an underlying cancer. This includes symptom onset in adulthood that is not associated with use of particular medications, obesity, a positive family history, nor certain underlying disorders known associated with Acanthosis nigricans. Rarely, malignant Acanthosis nigricans may develop in childhood. In such instances, expertise indicate that warning signs may include rapidly progressive skin changes and involvement of mucous membranes. Individuals of the skin changes suggestive of Acanthosis nigricans. Diagnostic assessment may include the use of laboratory tests such as analysis of the insulin level as well as insulin resistance, levels, and fluid portion of the blood plasma, and test to measure the glucose levels in urine and blood. In urine and blood is called glycosuria. Or assessment of the both glucose levels in blood and urine samples, and final consumption of glucose dose by mouth glucose tolerance test. Diagnostic evaluation may include additional laboratory studies or specialized tests to help the detect or rule certain underlying disorders, include pain or endocrine, autoimmune, or other conditions that may be associated with Acanthosis nigricans and insulin resistance. Such analysis may include blood or urine tests to measure levels of the other body, measure levels of certain hormones, blood studies to detect the antibodies, antigen insulin receptors, and other body motions or other tests. In addition, in some cases, particularly for those who have signs of suggestive malignant Acanthosis nigricans, testing of removal of biopsy and microscopic evaluation of small samples, histopathological studies of the affected skin tissue.